Hemant Thacker is a cardiometabolic physician at Breach Candy Hospital, and he's joining us on the COVID rise, the cases rising in Mumbai, in Maharashtra. Doctor, very good evening to you. There was this word put out by the BMC Commissioner. Mr. Chahal had spoken about the monsoons perhaps seeing an uptick in COVID cases. Even last year, if I recall correctly, there was that fear, but not a significant spurt. Is that fear for real? How are you expecting these COVID cases to rise?
So we already have a fair amount of COVID, attenuated COVID, maybe with its variants all over the place in the city, which is why, as you see in the newspapers, our numbers are rising. But these are numbers. We don't really have moderately severe or severe disease. We have mild disease. Now, when the monsoons come in, for reasons known to the monsoon, where there's going to be a problem of hygiene, there's going to be a problem of water contamination, and there's going to be a problem of people conglomerating under a shelter for long periods of time, especially when they don't wear a mask. There's going to be an uptick in this too. So the moral of the story is start masking as much as you can. We as doctors still mask in our hospitals, in our clinics, and even in social functions. If there are more than 10, 12 people and it's a small closeted room, there's no harm in masking. A mask helps you prevent not only COVID, but so many other things. And Mr. Chahal has correctly anticipated that with the coming monsoon, there is going to be an uptick, and an uptick in COVID is definitely around the corner. Because, we had a lull because there was good immunity against the Omicron, BA1, BA2.2.1. Now we are seeing that since the virus was strangulated, it has produced tiny variants. I'm not trying to scare your viewers by saying these variants will be ghastly and will bring about issues where people will again go on the ventilator. But definitely they are going to produce a little more than the mild disease of Omicron, because they are a new variant. And the best way to protect from them, is to wear your mask and take your booster.
How efficient, Doctor, are the shots that we've taken, the Covishield, Covaxin shots? How efficient are they to tackle these variants?
So they are definitely efficient. Any man or any patient who has not taken the shots or the booster is more at risk of getting and contracting this COVID or its variant. And anybody who has taken the 2 shots and hopefully the booster, if you get the disease, it will be mild. You will definitely not go to the hospital, and it will help you. Because even if you have mild COVID, it may be mild on the face of it, but COVID in the body leaves behind long-term sequelae, the fatigue, the weakness, the sapping of energy, the tendency to cause blood clots. All that comes into the body when you have a COVID infection.
Then why do we have more, Doctor, why do we have more symptomatic cases? At least there is talk of more symptomatic cases appearing.
Correct. So this is now like the flu. You're getting people with cold, tickling in the throat, fever, running nose, feeling low and washed out. But this lasts for 3, 4, 5 days and it's over. And this is what we'll have to live with. Like people today say, oh, why hasn't he come to office? He hasn't come to office because he has the flu. 6 months down the line with adequate vaccination and attenuation of COVID, we'll say it's all right, he had COVID on Tuesday, so he will join on Saturday or next Monday. So we'll have to learn to live with this COVID. But you can prevent getting early on these problems by allowing good vaccination coverage and masking yourself with social distancing. Do not get into crowds if you can help it. And definitely take your booster and wear your mask. The cases are increasing in numbers. There are numbers which are significant. The disease may not be that much as of now.
All right, Doctor, thank you so much. We'll leave it there, but this really helps put things in perspective for us. Meanwhile, in a big set